Ooh, my live stream is actually working. All right, folks. Just a few quick things this morning. I'm just doing a quickie. I'm actually just testing my network, to be honest. I'm going to be going live here in about maybe half an hour when I get to my destination. I'm going to share some information with you guys. So I was actually just testing my Digicel connection, because as you guys know, I've been having some issues with that they've been working on for me. So it may be sorted out based on this connection. I'm hoping so. That would be fantastic news. But a lot has been going on this morning. We've already received some information. We should have an official press release out from Health City here shortly, that basically some of their staff have now fallen sick, and there's like a presumption that they probably have the coronavirus. So not good, a little concerning, because obviously people in a hospital setting, staff getting sick, means that patients may have been exposed to them, and patients with compromised immunities, compromised systems. So this is the worst case scenario from the perspective of any individual patient who has been to that facility. Because remember, contamination, someone being contagious, like one physician had contact with him, they touch another physician, that physician might have it, that physician deals with two patients, those two patients dealt with their family members, their kids. I mean, it's just, the trickle-down effect is crazy. And to think that the irony of all of this could be that Health City will actually be the epicenter, potentially, of this outbreak here in the Cayman Islands is more than ironic. Yes, Steve, I am using my phone while driving. That is actually not an offense. The offense is whether you're hands-free or not. There's no law. I mean, I just love when people think they're such legal eagles and they're such legal experts. There's no law against driving, Steve, and using your phone. Everybody does it every single day. There is a law against being hands-free and using your phone. Nonetheless, since you have no other concerns than what I'm doing this morning, we will certainly be removing you from our page by the end of this live stream. We appreciate your commentary. Back to the discussion at hand, folks. This morning, we've gotten confirmation that Health City has recognized that several persons now at their facility are likely to have contacted the coronavirus from the Italian patient. And so we're going to be getting a press release from them shortly that we will be putting up. So please stay tuned here to Cayman Marl Road. We will certainly be updating you guys as quickly as we receive the information. We certainly don't want to alarm anyone, but like I said before, I think it's important to recognize the fact that in very, very real terms, this could be the epicenter of an outbreak for the Cayman Islands. This morning, Jamaica has confirmed now that they have a total of 8 cases. So, of course, we have very close ties to Jamaica. As of yesterday, Cuba had 4. So the numbers are expected to continue to rise, even here in the Cayman Islands. My question now is, what's the containment procedure for Health City? They're not taking any new patients, but obviously there are already patients there. And if you have a loved one at Health City, you would obviously be extremely concerned about that. So you need to contact them to find out what their plan is. As soon as we receive the press release from them, we will put it out. Hopefully they've established a direct dial number that anyone with concerns should be able to contact them. But listen, if you have been at Health City since March the 2nd, That was when we first posted up about this patient. And actually he went in on the Friday. So even before that, go back a couple days from the beginning of March. You need to make sure that you, as a priority, get tested if you have any concerns, for sure. So get tested, folks. I mean, I don't know how many test kits we have in the island, but of course it still takes 6 weeks to get results. And they have informed us that the equipment that we need on island to test ourselves isn't going to get here for another month. And this, I mean, now the government is on the ball, but we've been talking about this since January. And if you go back and check our live streams, check our stories, check our information, we have been asking from day one the response from the Cayman Islands government. That has always been our concern from day one. Where's their response? Why are they waiting? Why haven't we heard from them? So, when they eventually got on it, we're going to put $101.1 million towards it, blah, blah, blah. But it still takes time to get this equipment in. So, unfortunately, what that means now is that it's just crazy. It's just, what it means is we have to wait another month to be able to get hospital beds and testing equipment and all this kind of stuff, because you can't just today say, I'm going to need coronavirus equipment and have it available tomorrow. It does take time. Broward County, by the way, for those of you who are in the States, should be mindful of the fact that they now have, it seems like they have a cluster of outbreaks in Broward County. So if you've got kids who are in Miami, this is another concern, is that we have a lot of students overseas, university students who are going to be coming back. And of course, Cayman can't deny entry for their own residents and for their own students. So that also becomes a concern, because those persons, despite them being our kids, could very well be bringing it back as well. Steve, I'm going to actually show you my setup when I get a minute, but because I don't want to be touching and doing other stuff while I am driving. Mind you, I'm only doing 4 miles per hour right now, because I'm literally in bumper to bumper traffic. So whilst I appreciate your concerns, I can assure you that I have a little rig set up here in my vehicle for the times that I do have to actually go live to try to make it as safe as possible. And I will certainly send you that. But again, I'm now at 8 miles per hour. So I am not, look, a motorbike just passed me that's doing more miles than I am. So yes, safety first in all respects, but I can assure you that the mileage that I'm doing and the bumper to bumper traffic that I'm in, and I'm actually keeping my eyes on the road. That's why I'm not looking at the phone 24/7. That you should probably be more worried about the coronavirus than what's happening in traffic right now. So we've got a compass. Let's just flip this camera. Hold on one second. We do have a compass employee out here selling papers.
Good morning, ma'am.
Good morning. You're on live stream with Cayman Marl Road this morning. How are you?
I'm wonderful, thank you.
What do you think about the coronavirus situation?
So I can protect myself. You see me got on my gloves. Now next week I'll have on the mask.
Okay, the mask doesn't really help much, but anyway.
I know, but then the gloves are good too. And keep washing your hands.
Yes.
That's important.
Okay, thank you. All right. Thank you. So we do have an employee there at the Compass selling newspapers. She's got her gloves on. Listen, we're actually headed to Foster's because they have restocked. We got word from them this morning. Essentially, they had the equivalent of a Black Friday run on their stores yesterday. I mean, I saw the photos, like jam-packed. People are panic buying, and it's not necessary, but of course, psychologically, I do understand what's going on and why people feel the way that they do. I've not been to the grocery store in weeks to buy anything of substance, really. I'm not stocking up on anything. I've not even bought toilet paper to stock up on, which is still a bit peculiar to me. But maybe when I go by Foster's today, I may just do that if they have some on the shelves. But they have restocked, and I actually got tons of photos that, yesterday, like the before and after was amazing. The shelves were empty, but thankfully now their staff worked around the clock last night, and they have restocked completely. So Josephina says that her daughter's at home and she's not sending her to school. I do know for a fact that I think some of the schools were out. They were scheduled to be out anyway, some of the primary schools, because thank you, Lori. But you know what? Let me finish my thought about the schools. The schools are, because of the inter-primary day, I think some of them were scheduled to be out anyway. So that might mean less kids that were kind of out. Yes, I do touch my face. I don't think I do it excessively, but it's one of those things that a lot of times we're not entirely conscious of. But one thing I can tell you for sure is I wash my hands. I do not use hand sanitizers, because they strip your hands of the protective stuff that's on your hands. But I can tell you that I am obsessive with, well, not obsessive in terms of like OCD, but I believe in proper hand washing, and I always have. This isn't new just because of coronavirus. Always, always, always wash my hands thoroughly. And so, yes, I can touch my face. I mean, obviously it's not recommended, and it's not something that I'm consciously doing, but I am limiting my contact with people in terms of them touching my hands, so that if I touch my face and it's a situation of me, not really being in contact with what I would consider as high-risk individuals. Ooh, the sun is kind of out now. I need to get my glasses. But in any event, your first line of defense, hand washing, staying away from high-risk situations, which I have not been around. So Eunice says that school's actually in. So I thought the kids who were involved in inter-primary track and field finals today would have been out of school. So that's not the case. Oh, well, in that case, I know a lot of parents are keeping their kids at home in any event. So yeah, I did not send my son to school. He will remain home. Washing hands is very important. And carts in the grocery store. Yeah, there's certain places that are extremely high risk, like grocery stores. I'm going to actually ask this of Woody this morning, because he's like my go-to grocery store person. But I do want to know, are they disinfecting? They have the wipes there that you can actually pick out when you go into the store and wipe it off yourself. But by the time you've done that, you've already touched the cart, because most people get the cart first, push it in, and then the wipes are kind of closer inside the store. So you've already touched it. I mean, it's like, but this whole situation with the coronavirus worldwide is like the movie Contagion, where it just spreads like crazy. And all of a sudden, people who never really thought about like hygiene related issues are now engaging in like washing your hands. And it's amazing to think that people don't normally wash their hands. We should all be washing our hands. That should be the norm, to be honest. I guess we're going to learn a lot as a result of this. And we just all need to remain very, very vigilant. So we're going to bring you a lot of information throughout the day today. Like I said, for those of you who are tuning in late, we are aware now that Health City has concerns that they didn't quarantine that man early enough. And so it looks like it's spread now to some of their staff, and they're already starting to show symptoms. So in the event that you have had any contact with Health City or anyone at Health City, it is highly recommended that maybe you self-quarantine until you can get tested and feel confident that you don't have it and that you're not going to be passing it on to anyone. So just remember that the 14-day quarantine period, that's 14 days before you would be showing any symptoms. You are still contagious and you can still spread it during that time. So what that means essentially is you would inadvertently be spreading it to other people and don't even know. So that's a little crazy and unbelievable all at the same time, but that's what it is. So you need to know kind of what's going on and what the situation is. So we're just here at Foster's, and what I want to do is I'm gonna have to switch the device, what I've got holding this phone right now, to the other stand so that I can walk around with that one. So just give me a second here. Facebook needs like a pause button for live stream. I guess that doesn't really work. Just trying to see if we can find some parking. And as Steve pointed out, we are paying attention. We're not going to run that lady over who just walked in front of us as though she's seen a car in a hospital before. That's what my, we've got to find humor sometimes in certain things, but that says exit only, no entrance. So that's what my aunt always used to say with people who would, like, pedestrians who just like walk out in front of the car. She'd say, gee, I wonder if they have ever seen a car in the hospital, because they're so nonchalant about it that they obviously don't think that they're going to get injured. It's the vehicle that's going to end up in the intensive care unit. So it's just kind of a saying that we have sometimes, like, do people not know that honestly you can't really do that? All right, folks, so let me just hold on one second. I need to get my other, I'm just trying to get my other, microphone. It's like I travel with, and you know what? I'm going to take my wallet because I might actually find something in there that I'm going to buy. So, yeah, I have done no panic buying. I got to be honest with you guys. I am trying to just remain calm myself, because I do think that that's extremely important. So I've not bought a single case of toilet paper in weeks because I always buy it in bulk anyway. So it is, oh yeah, this is a problem now, because if I try to, hold on, this little phone gadget, I got some new equipment coming, guys, that will hopefully make my life a little bit easier in terms of live streaming. Equipment is important with a lot of different things in life. And so we have had to, what we call, level up with some of our equipment, invest, and more. Of course, all of it costs money, but what are you going to do? Okay. So let me turn on this microphone. Okay, there we go. Put my keys in my pocket. And then I'm going to switch the camera here in a second so you guys can see what's going on. So we're going to start at Price Right. I may jump into Foster's. And then after this, I think we will check on the Cayman Bay store, because I know that they were restocking. But like I said, I spoke to Mr. Woody this morning, who is the MD or CEO, whatever official title, at Foster's. And he has they spent like staff working around the clock making sure that they can restock on the run that they had yesterday, so that I got somebody trying to call me here. Melanie, I'm live streaming. All right, so let me show you guys what I mean about this, right? Here we go. Okay, so first of all, absolutely no carts. So that means that when I go inside, I guess I'm going to see a million people inside. So I'm going to grab a cart, maybe, just in case. But here's the thing. So I grab a cart. It's not like the wipes are next to the cart, right? So I've already touched this cart. If it's already, excuse me, sir. Okay, thank you. If it has something already on it, then do I not automatically have it on my hands? But here are the wipes. So now, yes, I can wipe it down. Morning. Okay, so we do a good thorough underneath and on the sides. Thank you, Foster's, for putting that there. And ooh, there's tons of good stuff here that I need to see about buying. There it is. Okay, it doesn't actually look too crazy in here, to be honest. Morning. Yeah, it's not too bad. I mean, this kind of looks like a Saturday, you know. So let's go into the cleaning supplies section. So we got photos yesterday. There they are, unloading some stuff. So I'm going to show you guys in a minute here some additional. But we did get a lot of photos yesterday of empty shelves. And it looks like they're starting to replenish somewhat. So this is kind of like the back area where they have a lot of cleaning supplies. And I think they've added some additional, morning, how are you? They've added some additional things like, oh, there's Dettol, you know, there's just some things here, soaps and stuff. Actually, I need some Dial, so I'm going to grab this. You know, I'm not buying anything that I don't need because I think that doesn't make a whole lot of sense from a financial perspective even. I do need some gloves. So I use these a lot for when I'm in the kitchen because when I'm cooking, there's certain foods that I don't like to touch. If I have to mix something with my hands, I don't actually like to touch food. So I am a little... I don't want to use the word OCD loosely because I know that's a serious condition, but I get the large. So now these are $25.99. This is 2 boxes. Powder-free, textured. Okay, so this is like 400 gloves. So I haven't bought these in a while. They do last a really long time. So I'm gonna just get a few of those as well. And there's like Dettol, morning. I think I'll get one of these because, sorry, we do use this in the laundry room. So, and again, Dettol is like a first aid, medical, and personal hygiene solution. I did see someone showing how to actually make your own Clorox wipes with like a solution, like just Clorox and just getting the baby wipes. I do need baby wipes because I have a 3-year-old. So I'm gonna go to, normally I have to go to the competitor to get those because they have like the bigger box size. So I don't know if Foster's has those today or not, but we're gonna just double check. Since I'm here, it would be good to just make one trip. So as you can see, staff are definitely hard at work restocking. Do you guys have any baby wipes? Yes. Oh, those are wipes. Okay. So those are $16.99. I like a good bargain. So wet to dry in 20 seconds, in 10 seconds. Oh, I think I'm looking at the wrong box. Okay. Uh-oh, be careful. Oh, right. So this is the box of 528. You know what I don't like about these? I think I'm going to pass on this one. Because this is the one with like the super, super big, it's like 3 of the refills. And so I prefer the ones that cost you less have, where they have like all of the individual packs, because I keep a couple in the car. My husband keeps some in his car. It's easier to just grab a bag and go. So I'm going to pass on that. You still got to be sensible when you're trying to shop for things, right? Like this isn't me panic buying. I'm buying what I need and what I know actually works. Morning. What I know works for me. Okay, so there's Lysol. Again, I'm pretty sure I got tons of this. I always stock up on this stuff. So I'm not going to buy any. It's still, quite a bit of it here. I don't think I need any. I always keep in every single bathroom a disinfectant spray. And so that's at least 4 that I've got covered in each bathroom. So I'm not going to worry about that. There's some Fabuloso here. Sometimes the cleaning lady uses that. So yeah, I don't really think I need much of anything else. Oh, I do need toilet paper. Hi, honey. How are you? Good. You're the store manager. Let me just introduce you to everyone. We're live streaming at the moment. This is Glenn. I know him on a first name basis. Do not ask me why or how. But Glenn is always super awesome here. You guys have been working, I understand, around the clock, just trying to make sure everything is stocked up and getting supplies in.
Yes, ma'am.
What was yesterday like here?
Just like a Black Friday.
It was like Black Friday. Wow. Do you guys have any toilet paper? There's none right
We're
now.
out of toilet paper right now. We don't have any water.
No water, no toilet paper. Okay.
We're supposed to get one more container of toilet paper, but it's still in the port.
Okay, so it's still in the port. All right. So maybe later on today.
Yeah.
Okay. Thank you, Glenn.
You're welcome.
Alrighty. So again, you guys are still morning. How are you?
Morning.
You guys are still replying to Steve. Oh gosh. Susan wants 2 of the Dettol. Remember, we can only buy 2 per customer. So I can get you 1, but I can't get you 2. Okay, so no toilet paper, which I did want to get some of that. And no water. They have another container that they're going to be unloading later on. So everyone has said, who works in the industry, has said that basically yesterday was the equivalent of like a Black Friday sale where people were out and about being a little bit crazy. So I hate Black Friday and I hate crowds in places like grocery stores or anywhere really. So look at our little friends here. Lands and Surveying Department. What are you guys stocking up on this morning? What are you buying this morning?
Oh, I'm buying some Lysol spray.
Okay, good stuff. So, did people buy Lysol before this? I think that's kind of funny. So I'm just trying to remember what else I needed. Cleaner and bleach. I think I have. I'm always like stocked with stuff, so I think I have some of that. I need to check my list. I do have a list. So, are you shopping with a list this morning, or are you just getting? You're just getting your Lysol and that's it?
Just my Lysol.
Okay. All right. So these cleaning supplies are a little bit. There's stuff here for sure, not as full as normal. Toilet bowl cleaner. I'm pretty sure I've got tons of that. Yeah. So I don't think I need anything else. Can anybody else think of anything that I need? Some containers came in last night for Foster's. Yes, Andre, and they actually have been working overnight, unloading, getting the stocks the shelves restocked. Sorry. So they are working on that, and we got some photos that we're going to post up earlier that we received from them this morning, basically showing that everything in terms of food has been restocked, and now they're getting some of the other things out, like the cleaning supplies and stuff like that. So, yep. I'm going to just go over to the food section. Again, I'm not really I didn't come with a list, so I don't want to just randomly buy stuff that I'm not going to use or that's going to go to waste. So we'll see. Morning. So fresh section here is doing pretty good. Hi, how are you? Yeah, they've got stock. You can come and stock up in a few things here. Mangoes, my favorite. Lots of meats. You can get onions and potatoes. That lady threw her bag back. I don't know why. These look like the orange potatoes. I've never seen these so big before. Normally they only carry the small ones. I do need to come back and get those. They're really awesome if you make curry chicken and you put them in your curry chicken. Very, very tasty, very nutritious. Oh my gosh. Can someone let Noelle know that they have the M&Ms back in stock? Oh, these are like my favorite. Oh my God. Should I or shouldn't I? Let me think about it for a second here. 1 million calories, trying to lose weight, but they are oh so good. I don't know, Joy. People, that's just human nature. People are going a little bit crazy at the moment. And they're thinking they might be having to self-quarantine like everyone and shut down grocery stores. And so they want to have every imaginable thing at home. So I am totally getting one of these. They had these, I think, before Christmas time. And I gave them away as presents. But this one I'm keeping. Just FYI. There goes the diet to hell. So they've got the usual snacks. I try not to buy any of these if I can help it. Sometimes 100-calorie snacks, but even those are like, ugh. Okay. So that's it. Okay. Yeah, I'm ready to go. I am ready to check out. So why is this random cart in front of me with no owner and 2 cans of Lysol? Does that belong to anyone? Looks like somebody left those. Maybe they had too many. And now they are only going to be permitted to have, it's two per customer per item. And just remember, folks, if you're a Kirk shopper, they also now have a limit of 2 per customer. I don't think they're said per item, so I'm not sure if they meant to say per item, or if they're gonna just limit you to 2 per customer. So we'll see. All right, folks, so I got 1 thing of Dettol. Sue, did you want me to pick up that second one for you? I've got my thing of Dettol. I've got some gloves, some body wash, which I needed, and some much needed M&Ms, because you know what? Let's just be honest. Like, what is the one thing, if you were in an absolute quarantine situation where you could not leave your house for 2 weeks, like what is the one food item, not toilet paper and all the other stuff, but what's like the one food item that you feel that you could not live without? Like, what would it be? For me, oh wow, this is kind of tough. Okay, I mean, obviously I love chocolate, but that I couldn't live without, probably, oh, this is a harder question than I actually thought, but I do enjoy like fruits, so I'd probably just say a category of fruits, so like apples and watermelon, raisins, not raisins, but grapes. Morning, how are you? And that sort of thing. Yeah, I probably couldn't live without fruits as a category. I'm sure I could live without M&Ms for 2 weeks, or chocolate. I would hate to have to try it, but it's possible. All right, so my total is $58.76. I am not overspending because I ain't got no money, folks. So, oh, you found toilet paper? Where did you find toilet paper?
Right, it just come out.
Oh, it just came out? Oh.
They can't get one of it. I think they can get more than one.
Oh.
They can't get one of
One per customer. Can I have? Yes. Oh, perfect. Thank you so much. I appreciate it. So yeah, just a reminder, there is a limit. Is it one per customer for toilet paper? Okay, and I think cleaning supplies and stuff is 2 per customer. So yeah, so toilet paper just came in, folks. If you need toilet paper, come and get some. Oh no. Someone was vomiting. Oh God. What is that about? Oh, all right. I gotta put in my PIN code, so I can't make you guys see that. Just 1 second here. So somebody just threw up in Price Right. No clue what that's about. I don't know if it's the crowds that made them sick or what, but that's kind of scary. So just remember, folks, people are coming up to the register with excessive amounts of stuff, and the cashiers are having to take it back, and they're going to put those back, as you can see over there. So it is, Alicia said fruits, eggs, juice, and water. Good one. Yeah, water. Definitely water. Thank you so much, ma'am. Yes, thank you. And thank you, sir, for letting me know about the toilet paper. So I've got my toilet paper. And yeah, so just 2 per customer for like the Lysol spray, disinfectants, all that kind of stuff. So I'm just loading up my cart. Ooh, my M&Ms dropped. No. Oh my gosh. Are they okay? Yes, thank the Lord. So as you guys know, keep your receipts handy because they have to check. Oh, sir, excuse me. Where did you get the Clorox? Huh?
You get the last one.
Where were they? I didn't see the Clorox wipes. What? I didn't see Clorox wipes. I don't believe him. The last ones? Oh, man. Where were the Clorox wipes? I just saw a guy with some and I didn't see any before.
We're out of stock since yesterday.
He just walked out the door with one, said he got the last one. So.
Find out where he got it from because since yesterday we've been out of stock. Since
Okay.
yesterday, Billy.
He just had it in his hand and said he just got the last one. I wonder where he found that last one at. Listen, I want some Clorox wipes. I wonder how he finagled that. Maybe he's got connections or something. I don't know. Thank you, ma'am. So, that's interesting.
Ma'am, I'd like to see you. Why you write up my name in the paper that I was deported and I came back in fictitious name? This is Verona Davis. You alright?
Miss Verona.
No, you shouldn't have done that. That is illegal. And I'm going to take you to court. I was in hospital when you did that. On the sick of my bed, I had heart surgery. And you malign my name.
Miss Verona, you do know that I spoke to your daughter and
Yeah,
the photo.
my daughter is not me. You know how many problems you have caused me? You make the bus stop picking me up now because I am a mad person that's gone to you. I have 3 psychiatric evaluations, clean as ever. I have a master's degree in psychology and counseling that I did at ITLD. Somebody needs to shut you down, whoever you are or whatever you are. You can't be doing things like that. I came here as Verona Davis and I live here 30 years.
But you know that we were sorry? Who vomit? You're the person who vomits?
Yeah, nothing. I drank the drink.
Okay, but you do realize that the post that you're referring to had a picture and details of someone else. It wasn't you.
Yeah,
So-
but it became me
How does it become you?
Because a lot of people, and you put two photographs.
But we don't have a photograph of you, so we've never put a photograph
I
of
have
you.
photographs. I have a lot of photographs. I was the dean's student.
Miss Lady, yes. But your photograph, I've never had your photograph.
You're evil.
We've never put up your photograph, so you have misinformation. Oh my gosh.
You knew what you said when you talked to my daughter, and you honor her till my daughter asked her.
Okay, so she says she's
Yes, Lord, thank you.
completely sane.
It's true, you're cool.
Okay.
You can't find anything else to do. Nobody wants to employ you.
Yeah, okay, ma'am. Thank you so much. Okay, well, what a mess. Oh, sorry to hear that. So the staff are not particularly happy about that. Always some excitement. Desiree wants to know how much is the toilet paper. Hey, honey, how are you? Good. Always some excitement, child. That's Cayman for you. Cottonelle double toilet paper is $15.89, my dear. That's what we just paid. What a hot mess. Well, she outed herself about another story while she's here in Price Right throwing up, and staff not particularly happy about having to clean that up and deal with that situation. Let's keep it moving, folks. Good morning. Okay, you never know who you're going to run into. That's the beauty of life here. So I'm kind of wondering, do you think we need to go into the main Fosters? I don't know. I'm so over. As you can see, crowds. When you get into a situation with a lot of people, you never know who you're going to run into. Take it all in stride, my dear. Take it all in stride. Life goes on. She says she has a master's degree and she's had 3 psychological evaluations. Uh-oh, my receipt just got blown away. Oh my gosh. Let me go pick it up because I don't want to litter. And she's never had... Oh man, look at my receipt all the way under there. Hold on, folks. She's never had an issue. Like seriously? Hold on. She's never had an issue with anyone. Oh, there it is. Okay, got my receipt. She has never had an issue with anyone questioning her psyche. Okay, if you say so. Facts might be different, but anyway. For those of you who missed that entire story, I'm not trying to rehash it, but what happened was we were actually doing a piece on, oh God, what's her name now? Lavelle. And remember how Lavelle was like interrupting traffic and out there with chairs and bushes and blocking the highway. And so one of our sources said that Lavelle, and again, it was Lavelle's picture that was put up and all the information, that Lavelle had actually been deported from the Cayman Islands and somehow she managed to return and was eventually given status in 2003 during the mass status grants. McKeeva Bush, thank you so much. And they believed that she had a name change and that her name might have previously been Lavelle. So we had shared the photo of Lavelle. Oh gosh, what's this woman's name again? Anyway, there was a secondary post that made mention of the fact that she might have had a changed name of something else to Lavelle Davis, which I think is this woman, but her name is actually Lovella. Oh God, you guys will have to look it up. I can't even honestly remember. But yeah, Rosa, you kind of remember, right? So what I would say is, you know, her daughter did contact us and said, no, the person is mistaken about the name change being that name change. But at no point were we talking about this woman. It was just a situation where one of her informants had the names, which are very similar, I should say, a little bit confused, mixed up. And that is actually, what happened. So she's claiming that tons of people contacted her, and you know how people are, trying to make a story out of nothing. And that all right, so now I gotta go back to my hands-free situation here. Hold on. See, I've got this mic attached, which now I have to take off. And we're gonna go back to being hands-free again in the car. Oops. There we go. Hands-free. Steve, are you still there? So yeah, anyway, I can't even deal with that today. I wasn't expecting the last part of the video. Listen, yeah, Javette, listen, she doesn't have all of the details correct, but absolutely, we recognize that was an error. I think somebody's waiting for this parking spot, so let me just back out. We recognize that was, even if it's a minor error, it is still an error. We acknowledged it. We spoke to her daughter about it. We certainly apologized. It was not something that had been up for any long duration of time, because we were contacted immediately and said, no, someone is confusing. Okay, if you want me to come out, folks, you got to back up a little bit. Someone is confusing the name change. Like, we don't know what Lovell ever had her name changed to, but it definitely wasn't this Davis lady. And so it was corrected right away. But, listen, we completely understand how this works in Cayman. Even if you make what is considered a minor mistake, oops, sorry. Let me put this up a bit better than that. And it's up for all of 5 minutes. People will remember that from now until infinity. But if you get 97% of what you publish correct, people don't always talk about the 97%. They don't talk about, the post from March the 2nd about this Italian guy now being proven 100% accurate. Nobody wants to talk about that. It's just the one mistake. And we get that that's human nature. We've apologized to her. I'm sorry if it has caused her any distress. Obviously, I'm not a professional, but for her to say she's had tons of psychological evaluations and she's perfectly fine probably isn't the full story. She obviously seems to be, a little bit off with some things. And that's no excuse, and that doesn't make it right. But at the same time, the question becomes, we weren't talking about her, we were talking about somebody else. You could see how the person who provided us the information, who had 2 persons with known cases of mental health issues, genuinely just got them confused. It was not a malicious thing. And listen, there are sources that I can swear by in terms of their authenticity. 99%, this particular source is always spot on. This time they made an error in the names, not in the persons that they were thinking about, just in the name change bit of information. And so this person, I know, had no malice involved in divulging that information. That information was 100%. In terms of, they had experiences in their job with this person. It's just that they recalled the wrong name regarding the name change part of it. So again, if we need to apologize to her again, we will. If she feels like, getting a lawyer, she can. We had spoken to her daughter at length about the situation as well, as it unfolded. And so sometimes all you can do is apologize. We do our best to verify and cross-verify things. We have made our mistakes. There's no 2 ways about that. In 2.5 years, we have made a few mistakes. And there's sometimes when we will honestly say, listen, this is a rumor. This is a situation. We don't have any confirmation on this. We don't actually know, but we're going to put the information out there so that the public can then kind of decipher. But in that case, yeah, we did take information from our source that was slightly incorrect in terms of the name. So try behave and go down a glass house. Try get them some hell, my dear. I don't know. They looked like they were a bit concerned yesterday. I don't know when the next press conference will be, but we will certainly do our best to be there. You know, we'll see how this is going to play out. There are a lot of people who are extremely, extremely concerned about this. So again, folks, the news this morning is that Health City, in all likelihood, has more than one person now, including staff. I refuse to drive on this bypass still because I think there's still smoke there, and I can't. My sinuses can't really deal with that. My nostrils are burning for 2 days on Tuesday when I went by there for all of a minute and rolled down my window, so I'm not going to do that again. So, yeah, so the Italian patient, 68 years old, that has been confirmed as the first Cayman Islands case of the coronavirus was not properly quarantined. That's the only way that this could have spread. And so now staff at Health City have fallen sick, and as a result, they are now saying that they suspect that those are cases as well of the COVID-19 coronavirus disease. So kind of crazy to think about, because I mean, of course, I don't know how many people at that hospital would have gotten in contact with him directly, but then they would have contact with people who would have contact with people who would have contact, and the list just goes on and on. So if you have 300 people working at Health City, how many of those 300 persons may have been in contact with someone who was in contact with him, and that kind of trickle down effect? Yes, Paul, we've already talked about the phone situation before in the car, and had you tuned in earlier, you would have seen a response for that, so you can feel free to go back and have a look at that. Anyway, we are going to go ahead and end the live stream now. I thank you guys so much for tuning in. We will keep you updated as and when we get additional information, and we will just let you know and advise you from there. So stay tuned, folks. We appreciate you tuning in this morning.